Hello, everyone. This is Jennifer Salazar from the Houston Better Business Bureau Education Foundation. Thank you all so much for joining us today. The Houston BBB Education Foundation Scam of the Week for September 28th, 2020 is Medicare genetic testing scams. Let's review some examples of genetic testing fraud. So basically, a company is offering you a free testing without a treating physician order and then billing Medicare. So what they're doing is they're offering you a test for genetic testing and they're not getting permission by your actual doctor. These tests go by so many different names, cancer screenings, DNA screenings, dementia screenings, and the list goes on and on and on. So how does this scam actually work? Well, individuals take a cheek swab and ask for Medicare numbers and personal information for billing purposes. They may say that we want to make sure you don't have cancer and we want to swab your cheek and send it off to a lab. The representative will falsely promise that Medicare will pay for these tests. All they need is your cheek swab. The representative may offer money or a gift, and you need to know it is illegal to accept anything of value, which is money or gift cards or even groceries, in exchange for medical services provided under Medicare. Also, some other ways this scam works. The representative may not even conduct a genetic test. Instead, they may ask for a picture of your Medicare card or Advantage card to check to see if Medicare or your Medicare Advantage plan will pay for these tests. Some labs may offer a cheek swab for genetic testing as part of a free health screening in order to obtain your Medicare information for identity theft or fraudulent billing purposes. So basically the way this whole thing works is you might go somewhere and you hear a presentation about cancer screenings or screenings for DNA, and all they need is your cheek swab and your Medicare number because Medicare will pay for it. Wrong. They only pay in certain situations, which we'll get to that in just a little bit. Where are these scam tests occurring? Let's review. They're occurring at churches, health fairs, senior housing units, senior meal sites, educational sessions, home health agencies, basically anywhere older Americans meet, and even parking lots, if you can believe that. But even worse, you may get a call from someone asking, would you like a genetic test mailed to your home? That's right. All we need is a Medicare number. Beware, beware. As you may know, scammers like to keep up with the headlines and they like to target individuals on current events. For example, genetic testing and the coronavirus. Right now, when you turn on the news, all you see is updates on the coronavirus. Well, scammers are linking genetic testing to the coronavirus to try to get you to fall for these scams. For example, you need to ignore offers for vaccines or virus kits, genetic testing, or miracle treatments. As you can see, someone may be calling you about a coronavirus virus kit and then say, oh, let's do a genetic test as well. No. Also, something about coronavirus. If you see ads that are talking about prevention, treatment, or cures, ignore them, delete them, because they're trying to load a virus onto your computer or onto your phone. And last, you won't hear about a medical breakthrough for genetic testing or coronavirus for the first time through a sales pitch or an ad on the television. Medicare will pay for genetic testing, but they only pay for DNA genetic testing in rare circumstances when it is medically necessary for treatment of a diagnosis of a medical condition. Also, Medicare requires an order from a treating physician or qualified practitioner and a signed beneficiary consent form prior to paying for the genetic test. Let's review some safety tips to keep us safe against genetic testing scams. I want you to be aware of the following. Number one, if you really need a genetic test, it would be done at your doctor's office and not at a health fair. Would you have a medical exam at a senior center? No, I hope you would not. Also, people have been stuck with big bills when their insurance plan decided the test was not medically necessary. Also, If the client does not pay the bill, they may be sent to collections. If the test or product is truly free, you would not have to provide your Medicare number. Remember, Medicare numbers are worth at least $30,000. Never give your Medicare number or date of birth to anyone for tests not ordered by your doctor. I want to give you 3 words to use for life: protect, detect, and report. This is how you can stay safe against any kind of Medicare scam. Protect, detect, and report. Protect. I want you to do the following. Number 1, I want you to treat your Medicare card and number like a credit card because it's worth so much more. I want you to know that Medicare won't call or visit you to sell you anything. You'll get a call or a visit from the Queen of England first because Medicare's not calling you and they're not visiting you. Be cautious of offers for free medical services. Nothing in life is free but your mama's loving. These items are not free. Last year, $60 billion was reported in Medicare fraud, error, and abuse. Watch out for identity theft. Check your mail. If you notice things that don't look right, like credit cards you didn't take out, report it immediately. Check your credit card statements. Check your credit reports. Review your Medicare summary notices. Pass this information on. I don't want you to do the following. I don't want you to give out your Medicare number except to your doctor or other Medicare providers. And I don't want you to carry your Medicare card with you unless you need it. I've had a lot of people ask, well, what if I'm in a car wreck? Medicare can bill the hospital later. A lot of people lose their wallets or their purse, and guess what? Their Medicare number was in there and it is now stolen. Step 2, I want you to be a detective. I want you to detect. I want you to review your Medicare summary notices. Now, if you're on a Medicare Advantage plan, I want you to check your Medicare Advantage plan explanation of benefits, known as EOBs. I want you to look for services you did not receive. I want you to look out for double billing and services not ordered by your doctor. If you want to access this information online, you can do so at mymedicare.gov. Now, usually a Medicare summary notice comes in the mail every quarter, but you can check it live at any time on mymedicare.gov. Also, use a personal healthcare journal. If you need one, call us at the Texas Senior Medicare Patrol and we can send this to you. What a healthcare journal does is when you go into your doctor's office, you write down the appointment, what happened at the appointment, and then you compare it to your Medicare summary notice or your explanation of benefits. If something doesn't match up, call us. The 3rd step, the hardest step, report. Call the provider. Gather information and documentation. Contact the Texas Senior Medicare Patrol at 1-888-341-6187. This is free and confidential. Your information will not be spread and it will not be at any cost to you. Thank you all so much for joining me this week. Again, my name is Jennifer Salazar with the Houston Better Business Bureau Education Foundation. I'm also the Program Director of the Texas Senior Medicare Patrol for all 254 counties in the great state of Texas. If you need to report Medicare fraud, error, or abuse, call us at 888-341-6187. If you want to reach me directly, my direct number is 713-341-6184, or you can always email me directly at jsalazar@bbbhou.org. Thank you and stay safe.